and welcome to the February 15th Board of Douglas County's Commissioners 5:30 business meeting. We want to welcome those of you who are here at the old courthouse and folks joining us on Zoom. To get us started, here's some information about public comment. Each action item on the agenda will offer an opportunity for relevant public comment about that topic. We ask that you wait until the agenda item you're here for comes up for discussion. Additionally, near the start of our meeting, we'll invite folks to provide general public comment to the commission, which is a time for addressing issues not on today's agenda, but related to general county business. Public comment will not be recorded and shared on our county's YouTube site to ensure compliance with YouTube's content policies. To hear public comment, individuals can join us live on Zoom or here in the courthouse. When we first call on folks who are here in person, we will then ask those to raise their hand online to comment. So if you're on Zoom, please plan to use the raise your hand function when the time comes and listen for staff to call your name. All comments will be limited to 3 minutes, and we ask everyone to give their full name and Douglas County residence for our meeting minutes. All public comments should be directed to the County Commission. We also reserve the right to mute and remove any speaker who is vulgar, rude, or inappropriate. The public should also know that comments received by the Commission during our meetings do not represent the views of Douglas County government. If visual aids are used during the meeting, the presenter will share their screen. Please note that online participants will not be able to view them without a computer, smartphone, or tablet during tonight's meeting. Materials are published online for your reference also. Lastly, a recording of this meeting will be available on our YouTube page and website. So tonight's agenda, we have 6 consent agenda items. Then we'll do general public comment. We have 2 regular agenda items. Both are for information purposes only. Then we'll go with appointments, commissioner administration, or miscellaneous before we adjourn. With that, we'll move to our consent agenda. Commissioners, is there any item which a commissioner would like to have pulled from the consent agenda for further discussion? Nope, seeing none. Is there any consent agenda item that a member of the public would like to have pulled for further discussion? Seeing none here in the courthouse. Anyone online, Sarah? All right. Commissioners, I'd take a motion for the consent agenda.
This is Commissioner Reed. I move to approve consent agenda items 1.1 through 1.6.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Passes 3-0. Now we'll move on to general public comment. Open it up here for folks at the courthouse. Does anybody here like to provide general public comment? Yep. You may sign in after you provide your general public comment. That would be great. And
So this is a time in the process where we collect information and gather information. We hear from the public, we hear from experts. All of that is entirely appropriate. We do recognize that there are companies, specific companies that are looking in the area for specific projects. Of course, we knew that. Of course, we know that. What we have said from up here is that we do not have an application, which means we do not have something to vote on in front of us, which I think is what the community has wanted, but that's not where we are in the process. And as uncomfortable as that is, we have a ways to go. I would also like to say that though we welcome comments of all kinds, some families' worst day ever is not available for this conversation.
okay. We'll move on to our regular agenda. And our first item is a naloxone supply challenges and distribution opportunities in Douglas County. And I believe, hi, Lori.
Thanks, commissioners. We've got a few folks in the audience that are here to kind of talk to us about this topic. And this was really just something that we wanted Lori to kind of update us and provide a little background and history related to naloxone, Narcan, and what's sort of the status. And so maybe folks can kind of introduce themselves as they go along. And I'll turn it over to you, Lori.
Absolutely. Lori Alvarado, CEO at DECA. Thank you for time tonight to talk about the opioid crisis and fentanyl. All you have to do is read the newspaper as of this morning to realize how incredibly challenging this issue is and how prevalent it is, not only in the state of Kansas, but in Douglas County. DECA has had the opportunity, being a substance abuse provider for nearly 50 years in this community, to see all kinds of challenges with different drugs as they've come into being used more prominently. Right now, opioids are our challenge. And so we wanted to spend some time talking to you a little bit about our work in this field, also talking a little bit about some of the harm reduction strategies. Naloxone is one of those, so we will spend some time talking about that tonight and share with you some information that we have about the request for that particular drug reversal. So Chrissy Mayer, our Chief Community-Based Services Officer, is going to do a presentation for you, and then we will stand for questions or answer your questions as you go, whatever you prefer.
All right, thank you, everyone. I'm going to pull up a Zoom here. If you'll just give me, or not a Zoom, a presentation.
Tracy, while you're pulling that up, just a reminder, to get real close to that microphone so we can hear you.
Yeah, let me just get it. Sure. Okay, should be able to see what's on the screen right now. So thank you again for some time today. My name is Chrissy Mayer and I'm the Chief Community-Based Services Officer at DECA. And I'm just going to share with you a little information about our naloxone program that we've been operating in Kansas. We've had a lot of success with it, and so I'm excited to highlight that, and then also highlight some need that goes along with it. Before we might dive into that, though, I do want to talk a little bit about, well, just the need in general. As Lori mentioned, you can just open the paper and see where things go, but this is just highlighting how much overdoses have spiked in the past several years. And so there's significant issues with opioids in our state and in our community in particular. And you can just see the need there, and how many of those are involving synthetic opioids like fentanyl as well. So one tool to combat, oh my goodness, sorry. One tool to combat that is to utilize naloxone. So this is just an overview of what naloxone is. It's an opioid overdose reversal medication. It is administered nasally. So if you use something like Flonase for seasonal allergies, things like that, same idea. Very simple to use, easy to administer. Some of you may have heard naloxone referred to as Narcan or Kloxxado. Narcan or just general naloxone is a 4 milligram pack. Basically the pack you're seeing on the screen that comes with 2 doses. So 2 of those nasal sprays in 4 milligram doses. So you would have 8 milligrams total in one kit. There is also the option to get another brand called Kloxxado, which is an 8 milligram dose. Some people are preferring 8 milligram because of the powerfulness of fentanyl. Oftentimes multiple doses of the 4 milligram Narcan are needed. So the 8 milligram can be a more efficient way to do that. That is a preference issue as well. Naloxone works in about 1 to 3 minutes and lasts anywhere from 30 to 90 minutes, which gives EMS a chance to get in place and administer more life-saving measures. I do want to stress naloxone is perfectly safe for anyone to use, kids, dogs, anybody. It will not hurt you if you're not using an opioid. It will save your life if you are using an opioid and overdosing. So I think that's a really important misconception to share, because a lot of people are concerned about, well, if we give naloxone out, is it going to hurt someone? Is a kid going to get a hold of it? Even if they do, it's not going to hurt them at all. So just in Kansas, as I said, we've administered this program since August of 2020 based on funding from the state opioid response dollars. Those are given to us from KDADS. At various times, we've operated a wait list, and our most recent wait list ran from September of 2022 through December of 2022. So for about 3 months. In January, we were able to start sending out kits again. We can also offer significant training for community members, for counties. We have particular training, 30-minute training for first responders, and then also a general hour-long general community presentation. We do those virtually. We also do them in person. We've had several requests from entities in Douglas County. We've worked with entities in Douglas County to implement policy related to naloxone. In particular, the TRC here in town, we've provided Narcan to them and also provided training to their staff on safe administration as well. While we don't always know the Narcan that we send out, what happens to it, if it's used, if it just sits on a shelf, what happens exactly, we can estimate that approximately 140 lives have been saved based on our request forms. So when someone requests a kit, we ask them if they've had one before, if they've used one before, and if they say, yes, I used it to reverse an overdose, we count that as a life saved. We've reached almost, actually this month, we hit all 105 counties. I just got our request in this week, and that's where they happen. So I'm going to show the next 3 slides are 3 maps. This shows naloxone kits from October of 2020 through September of 21. What I want you to pay close attention to is Douglas County. So in that first year of our program, we administered 413 kits in Douglas County. The second year, that almost doubled to 736. And then right now, this is from October of 2020 through February 6th of 2023. And keep in mind, we operated a wait list October, November, December. So this is really about 3 weeks of the year. By the time we started shipping out, we've already sent 189 kits out in Douglas County. So significant need there that's been growing weekly. I looked at our request list this week. We had 30 kits just this week requested in Douglas County. So we're averaging about 25 kits per week since January 1st in Douglas County. So averaging about 25 kits, that would be about 13,000 kits annually. Our kits cost $39 each is what we purchase our kits for. We're purchasing generic naloxone. Name brand Narcan will last a bit longer, but it is a higher price point. So it's $47.50. It will last for 3 years. The generic has an expiration date of 2 years. However, we are told by the generic maker Patagus that they're expecting that expiration date to be expanded. So there is some benefit to purchasing the name brand Narcan just because it's more shelf stable essentially. We do shipping with our kits as well. Shipping does add an extra cost to this. We have talked about, especially in our high need counties, which you can see are, Douglas, Johnson, Sedgwick, Shawnee, some of those larger, more active communities. We've talked about doing a distribution day of just emailing folks who have requested kits and having them, hey, come here on this day to pick your kit up to reduce some shipping costs. So we're trying to explore some different options there. Occasionally we do get a note from folks who they've used our kits, and this is from the Kansas City, Kansas Police Department. They used our naloxone on an officer. They actually used multiple kits on an officer. They said they used 5 doses on him. And so they were incredibly grateful to have that product there. He does mention that fentanyl is the drug that was in their officer's system that he was exposed to. And so I just wanted to show, here's what a deadly dose of fentanyl looks like. It's small. It is incredibly, incredibly small. And so this is why it's critical that we have access to naloxone in public places, places where there's AEDs, places where there's kids, families, places where there's people. It's critical to have that because you never know when you're going to come across something like this. And right now the DEA is reporting that 6 out of 10 pills, illicit pills have naloxone in them. So our drug supply is incredibly contaminated right now, which makes this extra important to have some of these tools in there.
Chrissy, can I interject with a
Sure,
question?
yeah.
This is Commissioner Reed. So you just mentioned the, excuse me, say that statistic again about how many
6 out of 10 illicit pills.
have fentanyl in them?
Yes.
I mean, I guess I'm curious about the overdose rates of non-fentanyl poisoned drugs and whether or not, is it, obviously I know it's an increased risk significantly.
Sure.
But opioids that are not laced with fentanyl might still present the possibility of an overdose and therefore naloxone would be useful, correct?
Yes, absolutely. And that's one thing we've been, talking with physicians about co-prescribing naloxone. So, for example, if you have a knee surgery or you have your wisdom teeth pulled out and you're getting oxycodone or something like that, co-prescribe naloxone just because you never know who's going to get that. And naloxone can also be purchased at a relatively low rate with insurance. So for example, at my workplace with my insurance, I can get naloxone for $10 as a copay at my pharmacy, which if I'm filling an opioid prescription, filling the naloxone prescription makes sense as well. So there's some other, measurements that can be done even with those legal opioids as well. But yes, definitely still a risk. You don't know who's going to get it. Also, if you're taking a pain medication, maybe you're a little fuzzy on when you last took it. Anyone can overdose. That's the reality. It doesn't have to be an illicit substance. It can happen to anyone at any time.
Thank you for that.
Yeah, sure. I do want to share, some of you may have heard about a chocolate chip cookie effect. And this is kind of highlighting that illicit pills piece. So when fentanyl is mixed with other drugs, it's not mixed evenly. And so you can see here, there's a couple of examples. And if you think of a chocolate chip cookie, some pieces have a lot of chocolate in it, others don't. That's the same thing with fentanyl. You might be able to, have a piece of a pill or a part of a pill and be fine. Another piece might kill you. And we'll actually be highlighting a mother in Mill Valley here on February 28th at the public library who lost her son to a fentanyl overdose. He and three friends, so there were four of them. They had 2 Percocets, or what they thought they were Percocets. They each took a half. 3 of the kids lived and her son died. So it's just part of it, kids don't know what they're getting. And a lot of times just with the illicit supply, a lot of people think they're getting something that they're not. I do want to highlight just a little bit about, Lori mentioned that we've been doing, substance use for a long time, treatment for a long time. And so this is just highlighting reoccurrence rates. So if someone is, they're diabetic and they have another, they have an episode, or they have high blood pressure or heart disease and they have a heart attack, the physicians don't just say, oh, this is your problem. We're not gonna treat you. We're not gonna help you. We're not gonna give you the tools you need to be successful. With drug addiction, really providing people naloxone is a tool to help them be safe. And that's how I'd like you to start thinking about that. Drug addiction is a chronic illnesses and there is a reoccurrence rate. And so how do we help people live to get another treatment episode? So that's just something to be mindful of there. This is just a screenshot from our website. I wanted to talk kind of logistics about how our program works specifically. If people go to DECA.org, they can request an naloxone kit. We have 2 request forms. One is just for the general audience, and then the second is for our first responders. They click on those kits or those links. It opens up a form. People enter their contact information, phone number, email address, and we ship a kit to them. It's a really simple, easy process. You can also request training through our link as well. We do have options for on-demand training, virtual training, and then also in-person training as well. So it is a super easy thing to do. And we kind of have it down. We've been doing it for almost 3 years now. So we know how it works and we know how to get it done quickly and get it out the door.
Chrissy, can you speak to why the different request forms? Like, are there different either regulations or is it funding streams that allow you to distribute to first responders versus the general public?
Correct. So they're different funding streams. So we were recently awarded $500,000 to provide naloxone in 4 of the 6 EMS regions across the state. Unfortunately, our most populous regions, one of which Douglas County sits in, another which Sedgwick County sits in, are not eligible for that funding. So if first responders who sit in counties in those EMS regions request, we push them into our general request form and still try to supply through that request form. I will just kind of highlight our funding has been reduced from that. So last year, we had about $1.9 million for naloxone. We still operated a wait list. This year we have 1.5. So we do have less funding. We are, considering what are our other options. We're talking to our partners at KDADS and KDHE about what can we do differently. How do we get naloxone to people who need it? It's just every day we're hearing things. We're hearing from our partners at Midwest HIDA who are sharing significant overdoses. And I believe you all received some information prior that highlighted some overdose rates from in 2020, highlighting kind of the extreme jumps we've seen in Douglas County as well. It's growing. It's an issue here in our county. So I did want to talk a little bit about some solution-based pieces here. And this is one option. It's called One Box. And this was actually developed in the Appalachia region with West Virginia. This is a really cool thing. And what they're doing in West Virginia is they're placing these in different organizations, businesses, placing them where their AEDs are. These kits can be attached to the wall. Basically, you put a naloxone kit in it. If you need it, then you can pull the kit off the wall, or you can just pull the door down and you can click a video and it will give you a quick 90-second how to administer naloxone. So if people are afraid of administering the nasal spray, or they're not sure what to do, this is one quick way for them to do that. So there are lots of innovations, a lot of, interesting ways that people can engage and do this. We can partner with, libraries, bars, restaurants, schools, lots of places. We have had a lot of requests from schools. For naloxone, we, in December, we supplied Eudora with 8 naloxone kits to fit all of their buildings. We're getting requests from other buildings as well. And I know people are working on policy in order to do that. And we do have example policies that we've helped create with other organizations, including law enforcement entities, schools, nonprofits, and other organizations, just to ensure that they are utilizing the naloxone most efficiently and correctly, and it falls within their policy guidelines as well. So that is the information that I have. I'm happy to answer any questions or if anything would be helpful at this point.
I have more questions.
Sure, great.
Well, so I haven't heard of One Box. I've heard of Nalox Box. Is it the
Box,
same concept?
It is. The cool thing about One Box is the
The
video piece.
That's
Yes.
that. Yeah, I didn't know that to be a part of Nalox
Yeah.
Box.
Mhm.
You've spoken about having some sort of agreements with different organizations. You mentioned the TRC being one of them. I don't expect an exhaustive list, but can you speak about some of the other, especially local nonprofits or public buildings even that you have been in communication with that get supplied or and maybe if there are any and you're willing to say it, folks that you would like to get that distribution to that maybe that hasn't happened yet?
Sure. So in Douglas County, there's a group out at Clinton Lake, the Kansas Corps of Engineers, I believe. They've requested kits, so we worked with them to get kits, which makes a lot of sense to have, you know, kits out on the lake, especially in the summer with a lot of people heading out that way of camping and things like that. I would have to look at more extensive list in Douglas County to see specific entities.
I think I'm wondering about places like our shelters, the different shelter programs that we have.
Yes, and our staff have done some training with the homeless shelter. So they do have access to naloxone as well. Other places that would be critical to have this, local businesses like your downtown area, you know, stocking, you know, at least a kit on every block, you know, something like that. So people know where to access it. Schools would be a critical place to have naloxone, libraries, community centers. I think about like over at, you know, Rock Chalk Park, loads of people are in there, you know, for sporting events and the weekends, things like that. I mean, any place that you're going to have a large congregation of people, I think those would be critical places to have these kits. You just never know when you're gonna need it. That's the thing. And
Yeah.
everyone is kind of the sense, oh, this doesn't happen to me. This isn't me. Well, it happens to, it does. And so I think it's just, if we can normalize having naloxone out, I think that's a big piece of reducing stigma around drug use as well. If we're willing to say, yes, you know, we care about people, we want to give people a chance to get into recovery and treatment services. I think that's a critical piece and showing that, hey, we care about our community. We want people to live healthy lives and have that option. Naloxone is one really good way to demonstrate that.
You mentioned, thank you for that. And schools and libraries and community centers are all sort of, they come to mind quickly.
Mhm.
But I also think about, like you mentioned, businesses downtown. And, you know, what if there was one on every block? But also businesses aren't, you know, open all of the time.
Right.
And so I've been thinking a lot about what does it look like to have this available in sort of just the public open space, you
Yeah.
know, how and where to identify. And I don't know if there are models of that in communities. I've seen a vending machine of it when I was in Toledo.
Yep.
That was inside the correctional facility, like in the public entryway,
Right.
not exactly outside, but just thinking about that and how to, you know, that it's visible and accessible and helps, like you said, go to that point of normalizing it, just like AED
Yeah.
being around.
Yeah, you're absolutely correct. There are lots of options for, you know, naloxone vending machines. Even these like One Boxes or Nalox boxes could be, you know, stationed somewhere, you know, outside or in an entryway of, you know, a hotel lobby or something. The procedure, it would just be, you know, checking the boxes on a regular basis. So we would probably want to implement, hey, here's a weekly check. Someone goes and replenishes the boxes. My hope would be that every week we go, the boxes are empty because that means naloxone's getting into people's hands. And that is the most critical piece. You can't use naloxone if you don't have it. And so I think increasing access is critical. Also doing some distribution days. There are big community events that happen. There are, you know, St. Patrick's Day parades, Eudora Fest in Eudora, you know, Maple Leaf is maybe not the best example in Baldwin, but there are community events where people are that we could do distribution just to ensure that Douglas County residents have naloxone. I think there's lots of creative options, and this is a really good option for putting harm reduction tools in the hands of our community members.
One thing, if I can add,
Sure.
and perhaps Chief Joels could talk a little bit about it. One thing I've thought about is our Pulse Point app that LDCFM is working to try to get more awareness about in the community, which puts, which any user can tell where an AED is in a public space that, from what I understand, from what Chief Llewellyn has said, is it's a possibility that you could also co-list naloxone with some of that. So, maybe that's, just as we're thinking about ideas to how do we increase awareness for those locations, I think Pulse Point might have some potential help in that area.
Who would be in charge of the outreach to accomplish what you talked about? So having a naloxone availability at every block on Mass Street, some of those things, like that's a big education piece and a big outreach piece. Is there funding for that? Is DECA interested in that? Who could pick that up as a community?
Sure. So we do have a local community coalition, Engage Douglas County. We actually just met this week to talk about kind of re-energizing the coalition and ensuring that the coalition has a good standpoint. So I think that would definitely be an option for, how we could engage community partners in this. At the meeting we had this week, one of the participants said, we need to go to the community. We don't need to wait for them to come to us. And so I think there is an interest in that engagement. DECA is certainly willing and able to do some of that administrative piece. We're doing it on a statewide basis, and we'll be doing some more specific implementation pieces in the far western half of the state where we've had some additional funding to do so. So we definitely have capacity and ability to do so.
One way that I think is maybe good to get it out in the public would be our rural first responders. And I let Chief Joels know that I might ask some specific questions about that, or just to highlight that we've been educated about it a little bit, but we haven't had access to any naloxone either for rural first responders to carry with them. We haven't had full training on it. I recognize that it also expires, and it sounds like you're not as worried about that. You're just wanting it to be out into the community. So
Correct.
maybe that's not as big of a concern as we might have thought it was, or maybe it was when the supply was so much more limited.
Right. And from an expiration standpoint, we've given out almost 25,000 kits. In that time, we've been contacted and we've replaced 100 kits that have been expired. So that's a pretty good return rate. If we're purchasing 25,000 and only replacing 100 expired, we're in pretty good shape there. And when we met with that agency, we just said, hey, we're probably not going to give you 100 new ones because you didn't use all of 100. So how do we evaluate that and see what that looks like? And that's probably something we would do within Douglas County as well. If we see a bunch of expired kits, then we're oversaturating and it's not meeting the purpose. And so we would kind of evaluate our processes there as well.
So for rural first responders for medical, it's very limited in terms of what they are allowed to do, including not being allowed to distribute oxygen. That is considered a drug, at least under our previous medical director for LDCFM that also oversees the rural first responders. So as those discussions kind of unfold with the new medical director, would first responders fall into, if citizens can do this, then they can do this, or would it fall under a special set of rules where citizens could do it, but rural first responders maybe couldn't because we fall under a medical provider? And that might be a question for Chief Joels to answer.
I was like, I would defer to your medical director on that
I
question.
warned him and I didn't warn you.
Yeah.
Chief, do you want to say something?
Division Chief Kevin Joels, Lawrence Douglas County Fire Medical. So this is not an easy answer, right? It seems easy that if a mother, a sister, a grandma, an aunt, an uncle can deploy it, why can't a first responder? It does get a little convoluted with the Kansas Board of EMS and the Healing Arts Department and at the state level. It is certainly not something that we are against. I will say that the ability to deploy Narcan is important. However, it's not necessarily the most needed drug on our ambulance. We could actually breathe a person through their entire overdose. We would never even need to give Narcan if we were able to do that for them. The reason that we give Narcan is to be able to give the patient back their ability to breathe or their drive to breathe. If we have the ability to breathe for them, we would never even need to give Narcan. So it is important to have. Some of the first responders that you speak of don't have an EMR license or emergency medical responder license or an EMT license or a paramedic license. Being able for them to deploy, we can absolutely have that conversation. We spoke a little bit ahead of time. It is our intent and has been our intent since the end of last year to find a time and an ability to deploy and implement Narcan for first responders in the county. However, that's something that wasn't really budgeted for in this year's budget. I'm not saying that it's super overwhelming and we can't afford to do it. Or am I saying that, Sarah? We need a little more money. But that doesn't matter. That truly is not a matter. If we will be able to do that as appropriate. We just need to figure out what the best way to do that. I don't know that every single first responder in the county needs to have a dose on them. I do believe that police officers should have a dose on them because they do come into contact a little bit differently than we do because we have the doses with us. But it definitely is a conversation to be had. Dr. Cross would entertain this conversation without a problem, and I don't see there being really any hurdles to prevent that unless there's something that the Kansas Board of EMS would prevent.
And I'm not pushing for any particular solution, just that education occur and we have some kind of clear delineations of who might have that with them. And under ideal circumstances, rural first responders are met by an ambulance or a sheriff's deputy within fairly short amount of time. But we all know things like the tornado that we had that tied up all of those resources plus roads that sometimes we are on our own for a while. So I'm glad for those conversations to occur and just would welcome like when we can have that education piece for those first responders so that we know.
Yeah, I can commit to the first responders right now that our training division is more than happy to deploy that training, and we can do that next month. I mean, I'll make that commitment right now. I don't know what the training division, and I'm sure nobody's listening, but the training chief is not me, but I'm sure he will agree. So we can do that for sure. Is there any other questions on
No, but
the
thank you.
EMS side? Okay.
Well, and one of the reasons why I wanted to have this conversation today is that, there are funds available. The county and the city have received opioid settlement funds. And so part of what I'm hopeful about this update is also that we can have conversations about how best to use those funds, how best to use those funds to help support this work and the work in other areas of prevention. And so I think all of this is helpful to help. I never like to tell Division Chief Scholes that there's an open checkbook, but there are some funds available. Yeah.
I also like the more that we can talk about it and the more different groups we can educate, the more that information gets out there. Because I can tell you that the first time I heard about it was through my work as a firefighter or first responder. And it sounds pretty incredible that such a small amount can be so dangerous. So the more we say it in the community, the more people hear it, I think is pretty important. And the rural first responders get that message into some areas that we don't reach in other ways.
I have a question, but first I just want to share some appreciation for the work Engage Douglas County is doing. I know we have some very excellent trainings going on, I think this week, right? Yes, at our schools to talk to our young people, because I do think that's a group of I think that's a group that could get nipped by this pretty quick if they're not paying attention. Chrissy, a question for you, and I think I know the answer, but I want it to be very clear and I want it to be communicated to the public. We are not out of Narcan right now. I hear that in the community that they're out. We don't have any, there's no way to get it. And I want to be very clear that is not the situation. Am I correct?
Correct. That is not true. Our supply is stable for right now. I will tell you probably by September, we will run out of stock if we continue to go at the rate we are right now.
Right. But if people need it, they should go online,
Fill out the form.
fill out the form and do that. I just,
Yes.
sometimes we continue stories that aren't true just because we don't want to seem dumb,
Right.
but we do have a supply and it's available through DECA now.
We do. And so
Okay.
typically what happens with our supply, we download all of our orders on Monday morning. We ship on Wednesday. So people typically receive their order. If it's shipped on Wednesday, usually by Friday or Saturday, they have their supply. So it's a pretty quick process.
Thank you for that
Mhm.
clarity.
And also people are willing, if they are interested on the request form in the comments, they could say, I would like to pick up, and we could contact them to arrange a pickup time.
Thank you.
Thank you for that last point in particular. I have come to your office to grab some. I
Excellent.
had the experience of somebody who was very helpful to me. I think it was in October. Yeah, it was October right before you started the wait list, and she went and found 2 last doses for me in the building, which
Excellent.
I appreciated. So to that point, I love that we're talking about sort of all these creative ways to increase access while also theoretically decreasing a bit of cost burden and staff burden, in due time, because there's other access points for it and not always having to coordinate with DECA staff necessarily if there are other, if there's places out in the public to get it. I thought I had a question related to that, but it might have left me. So we'll just move on to my other question, which is, we're talking a lot about fentanyl in particular, and how acutely dangerous that is and widespread it is right now. Can you talk a little bit about other harm reduction strategies and techniques? And I'm going to ask you specifically to share any thoughts or insights you have about fentanyl testing strips. And then while I know this is not directly related to fentanyl, I'm also interested in things like, safe needle exchange, and just other strategies in addition to the naloxone, even though I know that's the literal title of our agenda item. But if you don't mind indulging me a bit, I'd appreciate it.
Yeah, no, happy to talk about some other harm reduction techniques. We were actually just at the legislature a couple weeks ago testifying about benefits of fentanyl test strips. And I believe there was hearings today that we submitted written testimony for. So fentanyl test strips are an effective tool, especially for someone who thinks they're getting something that doesn't have fentanyl in it. The fentanyl test strips are easy to use, but you have to follow the directions on how to use them. So there is this accuracy piece as well. There are lots of different ways to utilize the fentanyl test strips. There's a group in Missouri who they've started using them, and they provided some really specific instructions. There's a group called Dance Safe that has a really nice kind of one pager on here's how you use your fentanyl test strips. The thing with fentanyl test strips, if you're intentionally ingesting fentanyl test strips are not going to help you because all they do is say, yes, there's fentanyl in the drug. No, there's not. And then at that point, people have to make an informed choice about what they want to do. But I firmly believe that people should know what they're putting in their bodies. And if they think they're putting Percocet in their bodies, then they should know if there's fentanyl in it. So fentanyl test strips are incredibly cheap as well. I want to say the last quote I looked at, it was about $5 for a box of like 50. So it was, they're really inexpensive compared to naloxone as well. So definitely DECA is supportive of additional harm reduction tools such as fentanyl test strips. I hesitate on needle exchange. It's a lot more controversial just in the community related to access points. Is there a place for it? Yes. Is DECA the one to be an expert on that or speak to how it should be administered? Probably not. But yes, there is value, and we've seen effective syringe exchange programs in other parts of the country that have reduced, hepatitis, lots of other, diseases that go along with, using dirty needles. So yes, I think that probably would be. But any harm reduction tools we can put in place just so people are informed about what they're using and doing are effective things. And I'd be happy to provide that one pager from Dance Safe so you could
That'd be
learn
great.
more about kind of how, because they provide 2 or 3 different ways that you can test your drugs. There are options for post-consumption fentanyl test strips as well. So let's say you consume something and maybe it doesn't feel like how you've typically felt after using drugs or something. You can then test your urine to see if you were exposed to fentanyl. Some people find benefit in that, and then they can say, okay, maybe the supply of drugs I have this time are not a good use, and I don't want to use them anymore. So again, it's about being able to make informed choices and giving people resources to be able to do so.
I don't know if you can or not. And I don't know if Lori wants to. I'm just I'm going to do my own research on this. Trying to understand the legality issues of it, because there's been conversations about Wichita as a municipality decriminalized it. And so those conversations are bubbling up more and so I don't know if there's much to say about that, but I'm trying to understand, from on a legislative perspective, where might be some nuanced areas for us to consider supporting
Right.
the decriminalization of it, if that's a barrier that's current.
Well, I mean, Lawrence especially has been unique in, decriminalization of things. So, I don't think decriminalizing fentanyl test strips would be outside of the norm of things that have been done previously as well. I'm cautiously optimistic that the legislature, they're hearing that this is a problem. They're concerned. We submitted testimony for 2 bills related to fentanyl test strips, and removing that decriminalizing that aspect as well. So it would be my hope that after this session, that will not be an issue, and fentanyl test strips will be a tool that we'll be able to use. Because if you think about fentanyl test strips and naloxone, they're both harm reduction tools. And so, and when you think about them from a cost perspective, fentanyl test strips are significantly cheaper than naloxone. So,
Yeah.
You can take that.
I think I felt very surprised to learn that it needed to be decriminalized. I
Right.
had known about them sort of just a little bit in the past, and had no idea that there was restrictive
Yeah.
legislation that didn't allow for access and distribution.
Right. Yeah, they're just considered drug paraphernalia right now. And I think, we've been trying to do some education with our legislators, talking about, this is a harm reduction tool. It's not a tool to help people use drugs. It's a tool to help people be informed about the drugs they're using and make safe choices. And again, be alive to be able to seek treatment.
I have another question.
Sure.
So you mentioned about the possibility of fulfilling a prescription for naloxone at the same time as just picking up a prescription for regular
An opioid,
opioids
yeah.
prescribed by the doctor. And that is not because there would be any fentanyl in our drug
No.
supply. Okay.
Yes,
Okay,
our
It
drug
would be
supply, yes,
strictly for
an
overdose.
accidental overdose.
Okay, I just wanted to have that be, clear and in the
Yes.
public that the prescription.
Yes,
drugs
there are
are
not illegal
safe.
pills
It's-
that you would get from a pharmacy.
Yes.
What you get from a pharmacy is safe, and if you use them as prescribed, A-okay. It's when someone accidentally takes too much or they take something that's not prescribed to them. And that's also why we encourage people to get rid of their unused meds. So we have a lot of safe disposal options. We've partnered with several pharmacies here in town to add 6 new disposal sites. So critical to get rid of opioids in your home that you're not using too.
Can you mention where some of those sites might be?
Sure. They're at both, they're at Watkins Pharmacy, they're at both Jayhawk pharmacies. They're at Auburn Pharmacies in Baldwin and Eudora, and also at LMH as well.
Thank you so much for clarifying all of that.
Yep, no problem. Thank you.
The one over in the judicial and law enforcement center too, right?
Yes, yep. And that one, I don't think is a specific med safe, but it is a disposal site. I was just thinking the ones that DECA
Yeah,
put
no,
in.
that's
So
helpful.
that's good clarification. Thank you.
Thank you for coming. We appreciate it. I don't think we have any more questions except Lori. Yeah.
Can I make a shameless plug before we
Please.
leave? DECA also has an annual opioid and stimulant conference that we do statewide. So if anybody is interested in learning more about, all of the things that we're talking about tonight, as well as the entire spectrum of opioid and fentanyl, that happens in November, and check our website out in about August, I think is. All right. You can request information right now. So shameless plug about additional information. So, thank
Great.
you.
Might be good for our Facebook page. Chief Joels.
Yeah, just one more thing that I'd like to, and we can do this education for the first responders, but I think it's important for anybody listening, anybody in here tonight, to know that Narcan is not given in cardiac arrest. If a person is not breathing, that's when they would be given Narcan. If they have a pulse, we don't give them Narcan. I'm sorry, if they do not have a pulse, that's when we don't give them Narcan, when they do not have a pulse. So some people may see us doing something and why isn't Narcan given? There's a lot of opportunities to see how we do things in the public. Not giving Narcan during cardiac arrest is standard practice of care. It's not in the AHA guidelines, not in ACLS, and it's certainly not in our protocol to give it. So if you are confronted with that and you have Narcan and you still give it to them, they don't have a pulse, it's not going to just automatically give them a pulse back. It's not an antiarrhythmic. It's merely given for people who have no drive to breathe and still have a pulse. So start CPR, which can be partnered with your CPR education within your community and along with AED and Narcan delivery. So if there's any questions about that, you can contact myself or the training division at Lawrence Douglas County. But there's a lot of misnomers out there that it can start somebody's heart back up, but that is not its intent. So just to make sure I understand that. Thank you.
Thank you.
Commissioners, I just wanted to suggest that I think this is a great example of kind of a season we're entering into in the behavioral health space, and the questions you raised around how does the community learn what's available, how it works, where it's available, when to access it. These types of questions are really important to build community understanding and awareness. And so we've been having conversations with DECA, with KSPHQ, and with community partners like the library and the cruising cupboard at Just Food to figure out how we kind of embed this learning and these resources and these materials. And I think as we move through, the rest of the winter and the spring, we'll bring you some more ideas and build on some of these as well.
Great. Thank you, Baum. Okay, there's no action on that item, so we'll move on to our next item. But we'll take public comment.
I know it's weird when we don't vote.
I know. Mhm. Is there any public comment on this item? Anything online? Oh, great.
We're moving you into the panel and you can come off mute and you can provide your public comment.
Hello, my name is Savannah Fergus. I'm a Douglas County resident. I'm in North Lawrence. Firstly, I wanted to thank you guys for prioritizing this issue. As somebody who's been personally and professionally affected by this crisis, this is incredibly important to me. Commissioner Wiley mentioned the shelter, and as somebody who's been at the shelter, this is something we're trained on, we use, we talk about. I am confident all of our staff would be able to use Narcan. I wanted to mention some other harm reduction programs that have worked across the country, like you mentioned, fentanyl test strips, MAT programs, safer smoking kits, safe needle supply, access to sharp containers, even non-judgmental STI and STD testing are all part of harm reduction that we need to have here. Lastly, I just wanted to thank you for recognizing compassionate solutions to this opioid crisis. And I really, really appreciate this conversation. Thank you.
Thanks, Savannah. Any other public comment? Okay. We'll close that item now after we did public comment. I move to another informational item, an update from for Douglas County Housing and Human Services and landlord engagement. And we'll turn it over to Jill Joliker.
Good evening, Commissioners. I'm Jill Joliker, the Assistant County Administrator for Douglas County, and I have the pleasure of working with our Housing and Human Services Program Manager, Gabby Sprague, who works very closely with Marielle Ferrero, who are both here tonight to give you all an update on 1 year into this first year of our program here at the county. I just did want to note, it started out as being a human services program, and we've relabeled it the Housing and Human Services Program because, as I think you're going to hear tonight, housing is what we lead with, and there's a lot of important work has happened this year. And Gabby and Marielle are going to go through that. There's a lot of slides that were included in your packet. We wanted to provide that to you as far in advance as possible so you had a chance to take a look at it, have a chance to maybe marinate on some of it and come with questions, but they are going to try to move through those quickly so that you can have questions. And with that, I'm going to hand it off to Gabby.
Hi, Commissioners. As Jill said, my name is Gabby Sprague, the Housing and Human Services Program Manager. I also have Mario Ferrero with me, who is the landlord liaison over at the Lawrence Douglas County Housing Authority. While Marielle doesn't really work for the county, we do often work in tandem, so that's why she's here today for the Housing and Human Services update. But I'm going to jump into those slides that Jill mentioned. Like Jill mentioned, there is a lot of slides, and I know that they have been in front of you for a week right now, so I'm not going to spend a whole lot of time going through each slide in depth, but we will go through this here. So I wanted to situate the work within the housing continuum. This is a housing continuum put forth by the City of Lawrence in previous agendas. And I wanted to situate our work here with the rental availability lists and landlord incentives being what Marielle does over at the Housing Authority, and then deposit assistance, rent, utility, landlord tenant mediation, and then researching tenant legal representation as something that the Housing and Human Services Department does. To talk a little bit about rent utility assistance, as you may know, the Housing Stabilization Collaborative is a collaborative among with over 20 different agencies doing rent and utility assistance primarily. We do some other programs too, but this is the one that we collaborate most often on. We have a demographic report here. Something to note is that we were previously, when this was in front of the commission, we were using numbers for the overall population, which included homeowners in addition to renters. And we are now just using renter numbers here in Douglas County. And you can see that here, and that is done with the support of the AmeriCorps member that serves with me, Jasmine Bates. We have 23 partners currently, and this is growing. I am going to be training the USD 497 social workers on Monday. We add partners all the time, and more people are becoming aware of this resource throughout our community. It's been great to see the amount of collaboration amongst all of us to accomplish this program. We also have MOUs with 4 agencies, the ones being in front of you there. These MOUs just stipulate what supportive services looks like coupled with the emergency rent and utility assistance. This stipulates what exactly those supportive services are in order to receive $150 stipend for the household that was supported through this program. In these we meet monthly to talk about what those supportive services look like, any changes to the program. Much of these meetings are really taken up by the transition between the lottery program, which we are now using, and previously when the application was open on a monthly basis, and then prior to that, it was open all the time. So we're kind of moving through a transitionary period and seeing what this program can really look like in the long term as primarily an emergency assistance program. And I want to note specifically, I will talk a little bit about the numbers. The money is important. So from March 2021 through December 2022 is the CARA program, which is the Kansas Emergency Rental Assistance Program, distributed around $20 million on behalf of 7,000 applications. The CARA program ended on February 1st of this year. So it was a huge resource of more than $20 million coming into our community for that period of time. I do want to note, and something that I attribute to the success of the collaborative is that although Douglas County accounts for only 4.2% of the state's population, Douglas County CARE payments accounted for 7.4% of the total CARE payments in Kansas. I think that the HSC and all of the agencies involved did an incredibly good job at facilitating access to this incredible resource while it was available. And while we're also looking towards the future, we have a lot less funding than we did during the CARE program being open, and also the funding that we had access to at the HSC through pandemic COVID assistance funds. So we have about $873,000 to distribute until December of 2023. This is being distributed through a lottery process. So it's around $75,000 into the Douglas County community on a monthly basis. That's only 5.3% of what the HSC funding spent between April 2021 and December 2022. Again, knowing that decrease in federal assistance for COVID. And this was less than what was present in our community per month if we think about CARE funding and HSC. Just to note, the small amount of funding that we have, we're trying to do the best we can with it. So we moved to the lottery program that I talked about. Like I said, the program was open on a first come, first served basis, but we would distribute the $75,000 within 9 minutes was the last time we opened up that application. So the need was really great. So we moved to a lottery program, and we did the lottery for the first time in February here. And we received 364 applications for a total requested amount of $561,000. So that it feels really daunting knowing that we only have $873,000 to distribute until the end of this year. Just to kind of see what that looks like, all that funding from the CARE program and what was available to the HSC from March 2021 through November. This slide here is adapted from something that was presented to the HSC in November. But it still reigns true here. You can see the current and projected funds is far below compared to what was in our community prior. And I wanted to talk a little bit about what Douglas County Housing and Human Services is insofar as doing data collection on evictions. We're looking to use a guide from the National League of Cities as a framework that hopefully we can use that to put our information into the eviction labs tracking system called the Eviction Tracking System. Then it's a national organization and thing that communities contribute to gather national trends on evictions. I'm not going to go through these very in depth, but you can see the eviction filing rate on this part of the spread or this part of the PowerPoint here. And also the eviction landscape. I particularly want to note that increase from 2021 through 2022, the evictions filed have gone up. Anecdotally, it seems like this is going to continue, knowing that wages are remaining stagnant and the cost of living continues to go up. Here's some data that we are collecting.
Gabby, I'm sorry to interrupt. Do you mind going back one slide real quick?
Yeah, sure.
Just want to make sure that for anybody listening or watching in the public, that those 3 lines that you have highlighted in blue, the orders of restitution filed, that's when basically an eviction is granted by the court, and that restitution is of the property to the landlord, right? And eviction dispositions is basically other resolutions that you have listed below.
Yeah, and thank you for saying that, Commissioner Reed. I do want to note that the order of restitutions filed, that is when the sheriff comes to a person's door and asks them to leave the property as a result of a court filing or the ending of a court. The ending of a court filing. So yeah, although evictions were filed here, the order of restitutions is about 1/3 of that.
Thank you.
Yep.
This is Commissioner Kelly. So that's a fairly significant jump in dispositions. Can you give some background on that?
Give some background on dispositions.
Yeah. Do we have an idea of why that number has? I mean, it has jumped somewhat, not as much. You pointed out the 2021 to 22, that's almost 100, right?
Yeah.
And then we look at the number of dispositions and it's jumped up as well. Are there things that are happening in the system that you'd like to tell us about?
I think it comes back to that the wages are remaining stagnant and cost of living continues to go up. And also the pandemic assistance that a lot of folks were relying on are no longer coming down the federal pipeline. And so I think particularly thinking about the programs and sort of frustrations with having to accept programs, that it seems like filings have risen as a result of those things that I've mentioned.
Gabby, this is Commissioner Willie. Can I ask a follow-up question with that?
Sure.
In terms of 2020 and during the pandemic, was there an inability to file evictions at any point during that time in Douglas County? That's something we heard about nationally.
There was nationally, and thus Douglas County was beholden to that. I know that I can't remember the period of time. It was at least 3 months at minimum, but there was an eviction moratorium between, I think it was between March and maybe even just July. But the burden of proof to prove that a tenant was could not be evicted was on the tenant. They had to come to the court with a specific piece of paper to say that they were not eligible to be evicted. So there was a certain amount of time, but I think really that difference in between the new evictions filed and the order of restitutions filed is because of all of the resources that we've plugged into our community to prevent evictions.
Thank you for the clarification. Appreciate it.
Yeah,
Yeah, and I would just add that the eviction moratorium, I agree with Gabby that I think that the money is what really helped curb that, because the mandate or the moratorium from the federal government was squishy, I'll say. And what we saw was a lot more people non-renewing leases and other ways that people were effectively experiencing that risk of homelessness, even though there wasn't an eviction happening.
and something that we don't have data collection for, oh, it's the next one here, is records of non-renewal. It's just not accessible. There's no way for us to really track those things. The same thing with illegal self-help evictions or people just changing locks on doors and not going through the court process. So yeah, that is something that our community should work towards being able to gather, in addition to the information here that we could plug into the eviction lab. Highlighted here are also some things that we can't find very easy. We don't really collect data on any of these things. When asked the county clerk's office as to whether we could do this, it was said that we do not have the capacity to compile this data at this time. So something for county commissioners to think about. Moving on to the mediation program. So in addition to rent utility assistance, we are doing a pilot mediation program with an organization called Building Peace, also with the help of Marielle over at the Lawrence Douglas County Housing Authority. Mediation occurs from Building Peace and we contract out to them. These numbers are no longer up to date. We have on the 6th, when I closed the application for February, we received more mediation applications than we did in the entire time that the application's been open since October. So we've received 22 applications for mediation currently. 8 of those, the landlord party refused to mediate. 7 of those are currently in some form of communication process where Mario is reaching out to either party to get their consent to do mediation. 4, there were no need for mediation by the time the application was being processed. 2 were mediated and 1 application was submitted in error. This program hasn't been used for lack of trying to. The community has been educated about this program quite a bit, and we're looking to continue this education and getting more landlords and tenants alike involved in this program. It really is an effective way to keep evictions out of the courtroom, where a person can get an eviction on their record and that be a barrier to housing for a really long time. So we're looking to bolster this as much as possible, although I think we need to incentivize all parties in doing the mediation. And that's just what I said there. I want to talk a little bit too about tenant legal representation. This has been shown in other communities and something that Douglas County Housing and Human Services has been looking at. KC Missouri, Kansas City, Missouri. This is a report that they did in the first quarter of the program. And you can see kind of the efficacy here. I want to note specifically that 40 of these were dismissed in favor of the tenant, and the total here with 4 cases that actually went through the process was 107. So that's more than a third of the cases were decided in favor of the tenant. Something that has been said is like, well, Kansas law really favors the landlord. So do we know that a program like this would be successful in Kansas? I have recently found through communication with Kansas Legal Services that a tenant legal representation pilot program is currently underway in Sedgwick County and has been for 4 to 5 years. So I'm looking at getting data from them to show the efficacy of such a program in Kansas. Also, Wyandotte County has now created a tenant legal representation program too, and I'm meeting with the director of that program next week. And I kind of wanted to situate tenant legal representation in the sort of landscape of eviction prevention. So maybe it starts out here, a tenant misses a rent payment or has another dispute with the landlord. We use an assistance program, we use mediation. We hopefully prevent the eviction with those. Something that's missing in our community, I think, is this tenant legal representation piece. When rent utility assistance doesn't work or it's not appropriate, when mediation doesn't work and it's not appropriate, we still need that pressure here at the courts, knowing that 80% of the time landlords have legal representation, whereas only tenants 3% of the time have representation in the courtroom. There's some other key considerations here. You can look through those. These have already been in front of the commission before. I have spoken with potential partners as to like what it could look like for this program to be a thing. Kansas Legal Services, Kansas Solicitor Defenders, I've spoken with specifically. The staffing needs would be around $150,000 annually for one attorney and one paralegal and/or advocate. I want to talk a little bit about the future of the development of the Housing and Human Services Subdepartment of the Administration Department. I just want to talk a little bit about the needs. So yeah, there were 262 orders of restitutions filed, 262 households that I don't feel like should have lost their housing. I would like to see more capacity within the Housing and Human Services Department to take on some of these and bolster the programs, the mediation program, and develop alongside partners and the legal self-help desk, a tenant legal representation program. I would say that the primary focus of this office has been supporting the Housing Stabilization Collaborative. I kind of assumed that the workload would get less with less money, but that is not the case. We have to be much more intentional about the funding that we're using and prioritize people because we're living or we have a scarcity of funding. Developing the lottery process and communicating that with partners and getting everyone on the same page, managing all of the funds that are being used to support the program, researching best practices, facilitating all the monthly meetings. We also have sub work groups that need facilitated. I'd say on average, the Housing and Human Services Department spends 75% of our time doing primarily the HSC and rent utility assistance. I would also like to see the HSC as a group talking about those supportive services and additional funding for rent utility assistance, moving towards more cohesion with the continuum of care or the federal sort of system that comes down from the federal government to the Kansas Homeless Coalition. There is a pot of funding called homelessness prevention funding that we could be using. But I'm looking to develop a program so we can have more time to move towards that. I would also like the Housing and Human Services Department to be able to support the housing and homelessness plan a little more. I know that will be coming up to the county commission and the city commission in the near future. And we really just need more funding for rent utility assistance. That 571,000 number for that 364 applications weighs heavy on my mind often. Something I want to know is just it's difficult. This work is difficult with folks coming to the office while the lotteries already happened and being like, is there any funding? And I have to tell them no often. And that happens pretty frequently. So looking to develop more eviction prevention resources in our community is something that I would like the Housing and Human Services Subdepartment to continue to work towards. And I will pass it off to Marielle for the landlord engagement update. And you can just tell me next slide, Marielle, when you need.
Is this a good time, Gabby, to ask some questions before we move on?
We do have questions built in at the end to encompass everything, but we can ask questions if the commissioners would like right now.
I can hold off if you'd rather.
Let's hold off until the end.
Okay.
Thank you, Gabby. Good evening, commissioners. My name is Maria Ferredo. I am the landlord liaison for Lawrence Douglas County Housing Authority. Gabby, if you will please show the next slide. So I'm here to talk to you about landlord engagement and the supports that not only the Housing Authority have provided, but what we have attempted to do in partnership with the Housing Stabilization Collaborative and the Human Services program at the county. So our goal here is to support the development and continuation of landlord and tenant relationships in Douglas County. Go ahead, Gabby. So our supports to landlords. So the main goal here in my position is to really bring on and onboard landlords, not only to the Lawrence Douglas County Housing Authority programs, but to any sort of assistance that will help tenants across Douglas County. So here are just some of the things that we do to support landlords to ensure that relationships are maintained, or when they begin, that they are on good standing solid ground. So go ahead, Gabby. So one of those big supports to landlords is the incentive programming. So I've been managing one incentive program for the better half of a year and a half now, and we have started another program. So the first one is the Landlord Risk Reduction Fund, which was an ESGCV grant and was also funding my position. So what this grant does is it directly works with folks who are experiencing homelessness or who are at risk of being homeless. So this helps incentivize landlords to rent to these folks who may have some higher barriers to housing. And so what we can offer with this programming is 3 months of additional rent that they can utilize for lease up bonuses, just to have as an agreement to go into a lease contract with the tenant, damage mitigation or unpaid rent mitigation to help with any sort of risk factor that a landlord may potentially be worried about. And in addition to the funding that is received with this particular grant, there's also partnering agencies that provide full case management services, meaning every month they have to check in, maybe come in physically to the unit to ensure that that tenant is successful, that tenant's needs are met, and that we can continue the relationship with the landlord. Additionally, with both programs, the landlord does have access to speak with me if there are any potentials of lease violations, if there's any issues between the landlord and tenant. The landlord does have direct access to talk to me. So this program, like I said, has been around since July of 2021. And we also now have the Landlord Partnership Program. This is a new program that we are utilizing the funds that we've received from the county. And this is for folks who specifically are on the Housing Choice Voucher Program or on a voucher program with the Housing Authority. And so we wanted to expand our incentives to all folks who have vouchers in the area, and all landlords who work with us, to also encourage landlords to come on to our program, because we know here at the Housing Authority, the voucher program is one of the most sustainable programs that is around and helps people maintain housing. So with this program, we do offer lease up bonuses, and we do have a pot of mitigation funding, again, to help if there are any potential damages. And that does not have to be a new landlord. That can be a landlord on the program towards the end of the lease if there's a move out, or if we're going to hopefully prevent a potential eviction, we can receive damage claims and pay up to $2,000 per tenant claim. So those are our incentive programs right now. Gabby, if you will please move on to the next slide. And this is a success of the Landlord Risk Reduction Fund. So from, like I said, July 2021 to present, we have been able to support now 40 households who have either been experiencing homelessness or at risk. And then here's just some demographic data on who we are serving. And as of January 2023, we've distributed almost $95,000. So the ESG funding is beginning to run out, but thankfully we do have the county funding, and our agency has been looking into additional funding that we can put forward to continue these programs. Next slide, Gabby. And as Gabby mentioned, looking at the housing continuum and how we fit in, we definitely feel like the space of entering housing from homelessness or being that prevention tool and help landlords just understand and get on board with housing as many people as we can, and also maintaining the relationship so we don't lose landlords, so we don't disrupt that very, very crucial relationship and partnership. Okay, Gabby, next slide. And finally, just a quick update. There has been for the past 2 years study and research on adding source of income as a protected class to the city's Chapter 10 anti-discrimination ordinance. From last night's meeting, the City Commission did vote in favor of adding source of income as a protected class, and also including immigration and folks who experience human trafficking, stalking, or domestic violence. So with this source of income ordinance added, this does mean that landlords would not be able to discriminate based on source of income. So meaning that if somebody has a voucher, they cannot outright refuse that tenancy because somebody has a voucher or some other form of rental assistance. What will that support in our agency as our voucher utilization? We have been seeing a number of families of households who are unable to find housing. So this could potentially help in getting more landlords to participate in the program. And I will say, as a representative of our agency, we are very dedicated to working with landlords, to answering questions. We have committed with the City of Lawrence to provide education. The ordinance will not go into effect until June. And so during that time, we plan to increase our education on our programming and try to be as supportive as possible to always serve. And that includes landlords, because we do need them to participate in our program so we can effectively house our clients. So that has been one of the big projects that we're working on. And that is, I believe, all I have.
And like this says here, open it up for discussion and questions.
This is Commissioner Reed. First of all, congratulations to you both for that vote that finally occurred last night at City Commission. I know that both of you were very involved in research and advocacy along with the city's HRC board. So I'm grateful that that is moving ahead. I'm going to go to it on my screen. You mentioned, Moniel, so 38 households experiencing homelessness or at immediate risk have successfully been housed with landlord incentives. Is that 38 households? Is that matched to this $94,951?
That is correct.
Well, I cannot do that quick a math. I'm just trying to think of like an average amount.
Yeah, average we're playing about 2,000 plus. I mean, really, it depends on the rental. So if it's 3 months rent, it's based on that monthly rent. But I would say anywhere between 2,000 and 2,500 is the average payment.
Which is really significant, in my opinion, to be able to put money in the hands of property owners and incentivize them to help us house more people. That's really significant. And so I'm grateful for that work. I wonder, well, I'm also curious if that 38 households, is that kind of a mix of new landlords, new voucher taking landlords, and I mean, I guess, is it all folks that have not previously taken vouchers but have signed up, and that's sort of the precipice for the incentive? Is that right?
It's a good mixture of both. So we did have landlords, because it is just based on units, so not necessarily program participant, but we have been able to get a handful of new landlords because of this, and have continued to house folks that even don't qualify for this incentive, who have gone beyond and taken vouchers beyond the initial.
Gabby, a question for you I have is, I mean, we got to keep thinking about this. How do we leverage more funds into our community? And I think that's going to take a variety of tactics and strategies. I think a lot about how much, and I don't know how specific a data you would have about this. I'm not asking you to do the labor to figure it out if you don't have it, but how much is going to municipal utilities throughout our county, in 3 different communities? And whether or not we have had any conversations with or trying to figure out different strategies for maybe those municipal governments to provide funding that supports their customers, their utility customers. I know the city of Lawrence sort of maybe has an assistance program related to their utility, but by experience as a service provider, not easy to understand how to access that or if it really exists, quite frankly, and people get redirected to HSC, which is mostly county dollars, some affordable housing advisory board, but I'm just curious about with our 3 bigger municipalities that all have local utilities, if we've had any conversations there about how to supplement the funding so that it through those governments also.
A couple of things. I don't know off the top of my head how much has been spent for utilities and how much has been spent for rent. It is a majority of rent, but I can't find that number and I'll include it in future memos. And so far as talking with the city of Lawrence, we are probably going to be receiving the water assistance program that you spoke about. So that will be some subsistence funding included into the HSC pot, so to speak. We are also, I haven't spoken with the city of Eudora or the city of Baldwin City, but that is a good idea and I will work towards that. Also, I wanted to note that I'm pretty excited about establishing a donor fund with the Douglas County Community Foundation to continue. A lot of folks have given the HSC checks through various sources, but it'll be nice to have one place where people can go and be able to contribute to that fund.
Mentioning that option for community members who want to contribute. My last question about funding, you mentioned more cohesion with the COC system and maybe some ability to draw down federal dollars. It seems like that potential might exist. The whole COC sort of landscape is convoluted and I'm not going to pretend to know very much about it. So I might completely misspeak and somebody should correct me if I do. But it has me wondering about, the HSC has been this really great shift in our community towards having a single pot of funds and a single source of access, both for service providers and for people to access independently without having to go through a caseworker or advocate necessarily. I'm wondering, are there other agencies, maybe specifically the agencies who participate in the COC and are providing services specific to housing and homelessness that have their own sort of opportunities to draw down funds that would be specific to their clients and sort of maybe help alleviate pressure from the HSC and serving the community at large of people. Is that making sense? I'm sort of rambling my question at this point, but just trying to understand if other agencies sort of have their either own pots of money or whether that's a part of the strategies to figure out some of those participating agencies, how they might access additional funds beyond this local pot of money.
I would say for better or worse, there is a disconnect between providing services specifically to people experiencing homelessness and homelessness prevention. And federal funding designates those kind of 2 things too through emergency services grants. So there's rapid rehousing, which specifically is for folks experiencing homelessness. And then there's also homelessness prevention dollars, which is specifically for people at immediate risk of losing their home. So I guess to answer your question, are there other agencies in town that could potentially be using that funding? Yes. So I think the HSC, knowing that kind of disconnect between homelessness services and homelessness prevention, I think the HSC is a really good model to work towards using the ESG homelessness prevention dollars. The only agency in town that uses that funding currently is Catholic Charities of Northeast Kansas, to my knowledge. But I think that there could be other opportunity to use some of that funding in other organizations as well. But I do think the agency is particularly situated to draw down that funding, knowing the strength of the collaborative, particularly in the application process.
I also wanted to add that I think when we talk about working more closely with partners within the continuum of care and the specific opportunities that Gabby's talked about, you know, I think that the agencies that are in the continuum of care that could utilize some of these funds, even if they applied for them, there's capacity issues within those organizations to administer them. And then, you know, thinking of rapid rehousing, and I know Savannah was on earlier and Cheryl from LCS are still listening and might public comment later, but, you know, even when we apply for rapid rehousing funding, there has to be some supports that go along with that. And there has to be capacity within organizations to support they're required to go with those funds. So when we think about expanding capacity, potentially within the Housing and Human Services program, we're thinking about those capacity needs throughout the continuum, that similar to how we've thought about how our funds are used strategically with other agencies and initiatives. It's using those funds to build capacity, but also leverage federal dollars. But more often than not, some additional funds need to be in the mix to build capacity within organizations. But Gabby and I have talked about that a lot. And I know she's trying to be really intentional about her time, and the time spent on the housing and homelessness strategic plan is the best example of how we're trying to make sure that's all part of one strategic plan with some real focused initiatives that aren't operating within silos.
Commissioner Willie, first I'd like to thank you both very much for the work that you're doing and the conversation that we get to have with you about it. I wanted to not take anything away from like the landlord incentive piece of it, but look at kind of the partner piece to it, which you talk about the mediation and kind of, if we frame it and think of that as like the low-hanging fruit of supportive housing is kind of supporting that relationship between existing landlords and existing renters when it's not a financial issue, but maybe a behavior issue of, you know, a disconnect between what is acceptable behavior to the landlord versus the tenant, and some of those, you know, significant that need to be worked out. But so that mediation piece, which I recognize is somewhat small now, but I see a real potential there to grow beyond just conversations at eviction, but conversations with landlords about, hey, I'm struggling here. I have this tenant who's tricky. I'd like to work with them, but I don't know what to do next. And I've spoken with people on both sides of issues like that, both on the landlord side and on the tenant side, of just needing someone to help manage that disconnect. And some of those I think could be resolved. So I love that you're already working in that space, and I would encourage you to kind of keep that lens as broad as possible as you have those conversations and get that word out to landlords, which is hard. It's, as we've started the conversation some time back about how do we do landlord education and landlord outreach. It is hard because we know how to reach partner organizations. It's a lot harder to figure out how to reach individual landlords. So I'm excited for that work and the direction for it. I don't know if there's anything you want to, Marielle, especially if there's anything you want to say back about that.
Sure. Thank you, Commissioner Willie. I think we're both very optimistic about the program. As the individual who's taking in the applications and trying to make that first connection, since it is mediation, both parties do have to agree. But I will say in the instances that it has been more of a relationship issue outside of maybe non-collection of rent payment, those have been the ones that have gone through mediation. Those are the landlords so far that have been like, yeah, I will do that. I do see the need to sit down with my tenant and try to work through the issues that may be having. So those have been very positive conversations, and they have been able to kind of listen. It's almost like a mediation when I give them a call, because I do get to hear what is going on with both sides, and that gives me kind of the opportunity to say, this is a service that's offered to you. If you have somebody there, maybe you can come up with a resolution to continue this tenancy. And I think that has been successful. So, and in marketing to landlords, when we had our landlord symposium and Building Peace was able to come and present, that was also a conversation of this can be used not just because of mispayment of rent, but if there really is any sort of relational issues that are bubbling up, this is a way you can be on the prevention side of that before it gets to that point where you can't even be in the same space together. So we have seen success with that, and I'm very excited to continue to see more applications, and we're hopeful that landlords will start applying to the program. We haven't had any actual landlords apply yet. It's mostly been tenants applying. But I hope maybe if there's a landlord or a few listening tonight that they hear that that is a resource to them, and that we have seen some actual individuals go into mediation for that and hopefully have found resolutions through that.
Thank you for that. I'm really excited to hear more about that work as it unfolds and develops. So thank you for doing that.
Gabby and Marielle, thanks for the presentation and all your work. You have made a ton of progress in a short amount of time, and I'm sure it can feel really frustrating when I see that $19 million number and what it is now, and to hear that we have over $500,000 worth of requests, you know, in 1 month. And, you know, I guess the budget request could be made for $6 million, right? So that we could cover that need. But my question is, as you've moved to the lottery system, or even prior to the lottery system, for those folks who aren't able to get that assistance, what other services are we connecting them to? You know, I'm just interested in that. You know, how are we helping them? You know, whether it's job training or there's a million reasons that people might be in this situation. How are we helping connect them to other services?
I would say that many of the requests for assistance are due to non-payment of rent. So oftentimes it's just that folks need a leg up. And also I hear what you're saying. We do provide the mediation as a tool. There's also the Lawrence Public Library's resource guide that we use quite a bit. Through partners, we've developed an HSC subgroup called the Communications Work Group, where we're working on, you know, best practices. And so far as we don't have rent utility assistance right now, here are the other resources. And there's mailers. People can also get connected to resources via the HSC list of partner agencies. That's at the bottom of the webpage as well. I think those are the various ways that we're trying to connect people to different resources.
I also was going to add, I mean, that's the beauty of this collaborative and the expert facilitation that happens on the part of Gabby and Marielle when they meet. So it's, there's a shared ownership of it. There's leadership, and there's a lot of work that happens from Gabby and Marielle and Jasmine. But at the end of the day, the power of the collaborative is the folks that sit in that space and problem solve together and think about, you know, what role their organization can maybe pick up, what's the role of their organization. And it's tremendous. All the agencies that were on that slide that Gabby shared, they show up to each of the meetings, they contribute, they're making calls for the rental availability list, taking time out of their schedules. And then, but I think that, you know, they're always thinking of new ideas. That's what I see in that space. And it takes a lot of time and patience and again, expert facilitation on the part of Gabby and Marielle to keep that going.
That's great to hear. Another question, you know, there's a disproportionality around race on the assistance that we're giving. And now that we've moved to a lottery system, what thought did you put into that disproportionality based on race and the system for distributing funds?
When you say disproportionality, are you meaning like historical marginalization of like housing history, or do you mean like in in the spreadsheet or the numbers that I've shown insofar as distribution.
Yeah, so what we see is that we're, based on our population, we're distributing more dollars to those who have been historically marginalized. And, did you put any thought into, having people, and maybe we can't do this, I'm just thinking aloud, like, where does equity fit into that? If that's the higher need category, lottery doesn't really adjust for equity. And what were your thinking on that?
I agree. And the lottery is still transitioning and we're still like developing it as it goes on. And this is something that will likely come up in our Friday meeting. I am trying to put together a sort of proposal platform to where any of the partner agencies can present a proposal to the group and we discuss it. But what Douglas County Housing and Human Services is going to propose is that we prioritize those who have eviction notices, court date notices, or 3-day notices, knowing that Black, Indigenous, people of color are often evicted from their homes at greater rates. I think there's also future conversations to be had about doing specific funding and making sure that we're meeting monthly guideposts or guidelines insofar as reaching the populations that we know have been historically marginalized in housing. So I think that's probably, it's difficult to move through changes so fast with a program, particularly when we have so many partners involved with varying ideals and words, even shared language is difficult to come by sometimes in these spaces. So we're all moving through it at a pace together. And I think that we're going to be able to prioritize folks. And I know that Housing and Human Services, we specifically have conversations in this office about how best to reach folks, particularly considering racial equity.
Thanks. I appreciate your thought on that. My last question is the question I ask the two of you every time you come. And I know we need more money for this, right? I understand that. But I'm also asking you to push our thinking from a policy level or a partnership level or a convening level. Do you have advice for us as we continue? Again, I think we've made a lot of progress, but I still think there's more progress to make here. And since you're working with these landlords and tenants every day, I'm just interested, lots to celebrate, I think, in the decision that was made by the city commission last night. That's a great example of pushing policy forward, but do you have any other suggestions for us?
I would say so far as engagement with landlords, what we're prioritizing is not only partnership, but education. I think in the past several months, obviously, it's been a very hot topic around our agency as the housing authority and what vouchers are and what fair housing is. And so education to not only landlords, but to the community about these resources, about their rights, about how we can better partner together, and seeing that from county leadership as well, that there's buy-in to that. I think the city last night showed that there is buy-in to partnership on their behalf. And they're doing that through policy changes that we can do at the municipal level, and that's fantastic. But I think there is an element of education that can be supported by both city and county, and I think that is just the opportunity to have more, to host more, and to share more information and education so that we're all experts on the subject matter. So if somebody comes in with questions, we can either support in answering or give them the contact of somebody who can provide that answer. So that would be my thing. And education is very cost effective too, and can be preventative, and a lot of opinions or maybe assumptions about what it is to receive assistance, what it is to be living in poverty or struggling to get what Gabby said is a leg up to continue and be sustainable in their housing.
And I just want to highlight something that I think I've been highlighting to the county commission for a minute is the tenant legal representation piece. It came up at city commission last night from the public. I think that looking throughout communities, it's been shown to be effective. And in speaking with lawyers in Sedgwick County, providing the support to folks, tenants just need someone to tell their story in the courtroom and speak for them and defend them in spaces that they don't get a lot of defense. And we see it in the ways that people don't show up to the courtroom even. Like there's a desperation sometimes in that space. And I really think that if we were to move that policy forward, it could be really beneficial. I think there's a reason that Kansas tenant landlord law so much favors landlords, and this is part of it. And we see the Wyandotte community and Sedgwick County community doing tenant legal representation, and I think Douglas County could make some strides in that way as well.
Thanks, Gabby. This is Commissioner Reed again. You read my mind. I was going to circle back to that because I always like to talk about tenant right to counsel and really hope for our community to make some tangible progress on that. So you mentioned earlier Kansas Legal Services and Kansas Holistic Defenders. You've had specific conversations with, which helped you sort of generate that range of cost. So I guess a couple of questions. One, when we talk about policy, does it feel necessary that I guess that there are policies, but as I understand them, generally at the municipal level, but maybe I'm misinformed about that. Sort of is a policy that states that every tenant facing eviction has a right to counsel through necessary in addition to the funding of it, right? Because in my mind, logically, if we're funding staff to do that, and that comes with a contract for services and an agreement about what those funds are to be used for, I mean, effectively, I suppose that's sort of policy versus, ordinances is what people tend to think about with policy and writing something in like the source of income non-discrimination ordinance. So I guess I just want to hear any thoughts you have about those things needing to sort of co-occur, or if the real point is if we fund it, then we have that option. And then my follow-up question is, I'm very curious to know if any conversations have happened with Douglas County Legal Aid. I noticed that they were, Douglas County Legal Aid. I noticed they were on your list. In my mind, that their office and the structure of their program might possibly be a really perfect fit for this very thing. And so I'm just curious if you've had any of those conversations yet. It also would theoretically change what the funding could look like because they're a clinic full of students with supervised lawyer, and their focus is generally on short-term court proceedings, which evictions are by design very short timeframes. So any further thoughts you have about that?
Yeah, there is obviously a difference between an ordinance and like a pilot program and someone actually providing it and the money needed to provide that program. So I mean, it is a policy in one sense, but also, yeah, you're right, the funding needs to be there. And I've been looking at grant funding potential options. To your point, insofar as Douglas County Legal Aid, I haven't had specific conversations with them, but I know that other folks in the administration department have. So that could be potentially looked at as a potential partner in this.
Yeah, we're actually meeting, Katie Fitzgerald and I are meeting with them in a couple weeks to talk about the driver's license restoration program. But we have talked to them about the emerging, the transition of needs that we need to shift our contract with them, because historically it was rooted in supporting juvenile services, and that's gone down. So they're ready to talk to us. So I'll make sure I keep Gabby in the loop on that. Our self-help center, our new director there too, Gabby's met with her already, and she knows they both know how important they are to one another. So I think there's a lot of fruit there too.
And I can speak to that a little bit. I mean, along with a tenant legal representation pilot, tenant education is also key to this. Not always do tenants have the time to go to court and do the thing and do all the paperwork and stuff, but sometimes they do. And it's a huge thing to know what to do in situations where a landlord is not providing good or like getting to maintenance issues fast enough, like heat or some of those basic needs we think about. So being able to also provide that tenant education piece along with the new self-help director, Brandy, that will also be key to development of any legal representation pilot program too.
Yeah, absolutely. And I know that the sheriff's office has a sort of resource list or packet that they give upon having to serve any 3-day notices. That just sort of, I haven't seen it in a while, so maybe it's changed, but kind of just a quick general list of places to call. Of course, Kansas Legal Services number is on that, but as you all are well aware, and I am, getting support quick enough is oftentimes the problem, right? Without that dedicated resource. So I think that that tenant education piece is so critical, because most people, when they receive that, the inclination is usually to just figure out what their next move is, where to go, how to get their, keep their stuff and get somewhere else, because they don't believe that there's any realistic option to sort of defend themselves in court, or why bother fighting it. I hear that sort of feedback all the time. So being able to, upon being served with that language that is given on that resource list, that is very clear that there's a specific program to call, one, the self-help center, to be able to call and kind of get some general information about options, and two, hopefully a very specific tenant right to counsel option that that prompts them to call and get answers to those questions, and then make an informed decision about whether or not to come to that Friday morning answer docket and move forward with contesting it.
I wanted to chime in there, Jim. I'm glad you've talked about the tenant education part of it, because in my experience in helping a friend, a tenant connect with Kansas Legal Services, that it still needed an intermediary in order for him to feel confident in accessing those resources. And I think, and sometimes it's time, sometimes it's technology, and sometimes it's just, there's a fear factor in working with an attorney if you haven't before. So I think there's an important space there too. And I also think that, any time that can be used as a last resort, that the legal representation is kind of the last resort, because it does kind of by definition break the relationship between a landlord and a tenant, even if it is resolved in the tenant's favor. So definitely a place for it, but kind of as a part of the spectrum of things. In terms of policy, I wonder if there's been any discussion about the city of Lawrence has a cap on the number of unrelated roommates that can be had in certain parts of town. Is that something that gets discussed much? And is there any movement on that?
The development code, the city of Lawrence's development code is being rewritten currently. And there is a draft on their website of changes. So I would encourage anyone who's interested in that to look at that as well. I don't know if that particular law has been particularly discussed. Maybe Marielle, but I think of that. I live in a co-op myself, and I have 10 roommates. So I'm very familiar with that. And I've heard a lot of folks who are interested in cooperative living, but yeah, it's not even an option within the city of Lawrence. So hopefully we can make moves in that direction.
And I would just add that the city hosted ahead of the source of income ordinance being heard one of the times, there was a meeting with landlords to answer their questions, and that was brought up multiple times by landlords as well as kind of a barrier for them to house folks. And so I think there is a lot of community interest in revisiting that particular code, because it has unfortunately caused some maybe unintended consequences over the years. So while it hasn't been specifically brought up in commission, I know that the conversations have been having. I'm hoping the rewriting of zoning codes will include something like that. And I agree with Gabby. I encourage that at least at the city commission level for community members to continue to bring that up, continue to talk about the other ways that we start addressing the housing crisis in structural policy driven ways that can be system changes.
I encourage you to be involved in the conversation, and I'm interested to be involved in the conversation. Luckily, I hadn't heard about that ordinance until I was out of graduate school, or we might not have made it through. I'm not the only one. I had one other question. Most of my other questions have been answered or asked already by fellow commissioners, and that is, so you showed the data in terms of percentage by race, percentage of households within each category, and percentage of funding and households that have been served. Can you, and I know that those questions have already been talked about. Can you also provide that by geography in terms of what percentage of renters exist in Baldwin City, Eudora, Lecompton, unincorporated, and Lawrence, and what percentage of funding is being allocated to those different geographies? And to start another conversation, because that might bring in new partners and just have an understanding of, are the dollars from the county staying within Lawrence, or are they equally distributed across other communities? Sometimes it's just a communication issue of do we push information out to other communities as well as we do in Lawrence?
I would say that a majority of the agencies that come to those meetings are from Lawrence, because that's where most of the agencies are. Lawrence, but the City of Baldwin City's public library, does show up to those meetings and is a partner with us. There's also an AmeriCorps resource navigator through the United Way of Kaw Valley, recently changed from the United Way of Douglas County, who is in Eudora, who uses some funding. There was some set aside funding previously. We're moving away from set aside funding, but we're not moving away from set aside funding for Baldwin City and Eudora specifically. There's a set aside amount of funding that, although we're a collaborative, I do feel like Douglas County is very obviously a Douglas County resource. So we'll be maintaining the set aside funding for Eudora and Baldwin City that are representative of the populations of renters there, using census data. So we will be encouraging people to apply during the lottery. There will be separate lotteries between each municipality with the set aside funding. So the other communities are being thought about and being included in these conversations as much as possible.
I appreciate that, especially incorporating it as part of the lottery, since those funds go so quickly. And if you have data from before the lottery, just to see kind of how those funds have been distributed, I'd be interested to see it. I would also say that BRAC, the Baldwin Retirement Apartment Complex, which is a USDA rural development housing complex, has been listening in on some of your conversations. Your meetings. I don't know that they've been invited to join, or if they have initiated that. I imagine they have not yet, but that is another potential partner.
Thank you. I know that they were in the audience when Marielle and I did some presentations over in Baldwin City. So I'll be sure to reach out.
And on that note of geography, I was scrolling back to the slides you had about with sort of the missing information in terms of the eviction data that you've been able to get through our county clerk's or through our clerk of the district court. I mean, just to specify, like when you say evictions in Douglas County most frequently occur in the following areas, that's what you're trying to get at, the geographic, like which cities or whether or not they're unincorporated. And that has been something that they have determined is too resource intensive to be able to determine. Is that accurate?
Cities, but also like census tracts and things
yeah.
like that. So it can get even more specific than municipalities.
Okay, that's helpful. Thanks.
Thank you, Gabby and Morale. We'll move to public comment now. Is there anyone here at the courthouse who'd like to provide public comment? Come on down.
Shannon Lowry, I'm a Douglas County resident and the executive director of the Housing Authority. I want to say two things, and I've been coming to support HSC since before it actually was funded. I think it was a real sea change. made a difference in our community. I think the single source is really important. I think as you see the funding decline, you're gonna get a lot of requests going forward in the next cycle by other agencies for rental assistance. And I would encourage us to hold steady on this single source to do this work. Before we had HSC, it was sort of this run around town trying to get $100 from here and $100 from there. And it was very time intensive for the tenants. And so this is a much better process, even if we have to go to the lottery, which is, you know, unfortunate, but probably one of those things where we will never have enough money. One of the first topics you talked about was, you know, sort of why the need, and one of the stats that we know is 50% of Lawrence is renters, and 50% of that, so a full 25% of our population pays at least 50% of their income for rent. That's not sustainable for most households. And so any little road bump causes them to be late on rent. And as we talk about the strategies for this, the absolute best response is to get the rent paid, which is why I mean, that's your best defense to a 3-day notice, to an eviction, to anything, is to pay the rent. And so that is really important. And the other thing is, one of the things the Housing Authority does is when a relationship is ruptured, we really try to get a mutual release from the landlord and the tenant, so they don't end up with an eviction. So as we talk about a right to counsel, I would really like us to focus on that end of it too, because once you're at the appearance docket, it's really a lot of times too late, unless a mistake has been made. And then the other thing is, the Housing Authority, we give a 14-day notice on non-payment of rent. I think 3 days is quite frankly ridiculous to have somebody try to pay the rent. The Housing Authority, we're prohibited from lobbying, but if we could change the law in the state of Kansas to give people more time when they are late on rent, that would be a really good solution to some of this problem.
Thank you, Shannon. Any other public comment? Online, Sarah? Okay. Any other comments, commissioners?
Shannon, if you don't go very far, I might ask you a follow-up question. And that is, in terms of the single source, would that also include like not approaching the utilities themselves to also offer some kind of assistance?
No, but it used to be that the situation was a little money was given to Ballard, and a little money was given to Catholic Charities, and a little money was given over here. And you know, I mean, like I had staff whose job it was to run around to all these places and try to get money to pay people's rent. And so this is, when I say a single source, this is for rental assistance and utility assistance that everybody who's kind of run into that life buzzsaw needs to just go to one place and get that assistance, rather than, you know, they go to Plymouth and they go to the First Methodist and they run all around town. And half the time they still can't get enough money to actually pay the rent.
Thank you.
Okay, this item was for informational purposes only. So if there's no other comments, Gabby and Marielle, thank you for joining us tonight and sharing all this information. We will move on to appointments. Commissioners, do we have any appointments?
Well, while we still have Marielle on the line, yes, Marielle she and I had a conversation this afternoon, and she is willing to be reappointed as the District 3 representative to the CJCC, the Criminal Justice Coordinating Council. And I want to thank her for the work that she's been doing there and her willingness to stay with it. And I do love that there is a community connection between housing and justice involvement. So thank you. I guess I should say, I would like to make a motion to nominate Mario Ferrero to serve again on the CJCC.
I will second that and also mention, since I didn't see you at yesterday's CJCC meeting, I have a Valentine with your name on it.
Wow. Moved and seconded. All those in favor say aye.
Aye.
Thank you, Mariel. Any other appointments, commissioners?
Think so.
Think so. All right, let's move to our miscellaneous items, and we usually start with Sarah.
Thank you, commissioners. Your memo is in the packet. I do want to specifically point out 2 items. The first of which is there is an update from Patrick Schmidt, CEO of Burt Nash, related to some clarification on some of the questions you all asked him at last week's Board of County Commissioners meeting. And so I want to make sure commissioners were aware that is included in the packet. Some of the specific areas are talked about are just some refined information related to the scope of services, partnerships with LMH, the band list, and competency restoration. In addition to that, commissioners, in your packet is draft legislation sponsored by Senator Marcy Francisco to create the Peasley Technical Center District. Wanted you all to have a copy of that proposed legislation, as there's a pretty significant role for the county commission if that were to go to a ballot and to serve as a countywide district. So in addition to that, are just our regular weekly legislative policy report from Little Government Relations is in there, and we're getting ready in a week or so here to have a mid-session policy update. And with that, commissioners, I'll just stand for any questions.
Questions, commissioners? Hang on, I want to look at one thing real quick. Sorry. My computer decided to sleep.
Oh, I'm sorry. Commissioner Kelly asked me to provide a weekly update related to TRC progress. So thanks for that pause. It allowed my brain to defrag my hard drive. So I want to make sure commissioners are aware of the progress that we're making each week. I had my regular weekly one-on-one conversation with Patrick Schmitz last Thursday, had that conversation, and we make that happen each week. In addition to that, county staff met and county legal counsel met with Burt Nash staff and legal counsel on Tuesday to really lay out a game plan for how we're going to approach the rest of the work ahead of us. As you know, as we talked about last week, commissioners, there's some deadlines that we've put on ourselves moving forward for this project. And so we wanted to make sure we were making regular progress for them and have regular meetings scheduled. We have all committed on that team to meetings, multiple meetings a week through the end of the month. And I am working on a list of additional dates for into March for those meetings. In our conversations, planning out what our kind of work ahead for the next couple of weeks, we're going to prioritize conversations about the terms of the operating agreement. As commissioners might remember from that deadline, from those deadlines outlined, is that we really want to come to agreement on those initial sort of large terms of the agreement within the next week or two. So we want to prioritize that. We're going to start that work in earnest on Friday afternoon at 3:30. Great time to have a meeting. So we're going to start that conversation then. And then we've got additional time set forward early next week to continue those follow-up conversations on the terms of the operating agreement. We want to get that done on that timeline and then move on to some other topics. So I'll just be prepared each week to sort of give you an update on how we're doing.
That's great. That was what I was looking for.
Oh, good.
Sarah?
Thank you.
Yeah, so that,
Good.
and if you could just include, I would ask that if you could just include that in your memo, just, it could be for me as simple as dates, maybe a brief, it doesn't have to be long. It could just be
Okay.
what the subject of conversation was
Okay.
and who attended each
Okay.
time. I think that would be helpful to me. And if you had scheduled a meeting and someone did not attend, I think that would be helpful as well.
Great. I will try to get that added to the memo each week.
Thank you. Commissioners, anything else? Okay, with that, we're adjourned.